So gum disease, it's a real thing. It's super common. Like 50% of people have it by the age of 30. But here's the thing. It never hurts. There's very little symptoms there. So people don't like being told they have gum disease. If you go to like online and you read like negative reviews, like 1-star reviews from all dentists, including myself, okay, you will see people who say that dentist is a liar and a cheater and is trying to steal my money because he told me I had gum disease and I know my insurance covers free cleanings. Yeah, they don't cover it when you have gum disease, and you need to really treat your gum disease if you want to keep your teeth. You don't have to. I tell people what's going on in their mouth, and we spend a lot of time educating our patients here because I've seen a ton of patients who've had deep cleanings, as they call them, at other offices. They have no idea why they had it done, okay? And their gum disease is still there, okay? Because they never even told they had gum disease. Maybe they used a term like periodontal or even scaling and root planing, and all these terms that the patient never really understood it. So they didn't change any of their habits. Maybe their dentist told them to floss more, and they're like, nah, I'm not doing that. But it's really important if you care about your health. Gum disease, yeah, you want to keep your teeth. Also, gum disease is related to heart disease, diabetes, cognitive dysfunction as we get older. It's a low-grade infection. We hear about inflammation, right? If you look into health things, this is inflammation in your mouth all the time. So we educate my patients a lot because it really is a team effort, okay? We're gonna educate you, we're gonna clean out your gums with a gum infection therapy, that deep cleaning. We're gonna teach you what you need to do and teach you how to follow up. And we're gonna make you understand why. Because more than really a lot of other treatments, if you don't understand why and you're not actually doing what you need to do at home, then it doesn't work. Then doing that amount of treatments, spending, it's just kind of like a waste of time almost, okay? So we spend a lot of time doing that. And then people, when they understand it, I think they appreciate it more and they see the value in it more. But it is a problem in the industry because, again, gum disease doesn't hurt. Patients don't like being paid for something they didn't even know they have. And they think it should be free with their insurance when insurance is crappy and doesn't cover much of anything. So if your dentist tells you have gum disease, ask about it, okay? Ask what questions you have. Go to a dentist you trust. Yeah, are there other patients that have come to me and they were told they need a deep cleaning and then they come to me and I evaluate their gums and I think they don't need it? Yeah, that happens. And then you know what also happens? The opposite. More commonly the opposite, because gum disease is undertreated. So people come to me, they're like going to the same dentist for 25 years, and all they've been getting is a regular cleaning. No one's ever talked to them about their gum health at all. They always just like, yep, looks good, see you later. And I look in there, and they've lost half the bone. They're well on their way to losing all their teeth. And I have to break this conversation to them. And now one or two things happens. One, they either think I'm a liar and a cheat, and this is where the bad reviews can come in if they think that. Or two, they understand that I'm, that I showed them the evidence. It's very obvious. They're like, I don't know, anyone ever told me that before. And then it's up to you whether you want to treat it or not. But it is a super common thing. Why do sometimes dentists treatment plan it and then I look and I don't think they need it? Are they cheats? Maybe, okay. There's a lot of, when people work for corporate practices, and they're all over the place now, they will sometimes push for treatment that's not needed. Okay, and I guess private dentists could do that too, but it's super common in corporate dentists because they don't really understand gum disease. They don't look at the whole person. Like sometimes I'll have someone that has kind of looks like to be in gum disease, but they're only 20 years old. Okay, they never floss. So instead of charging them possibly thousands of dollars to treat their gum disease, I'm going to educate them. We're going to do some cleanings. We're going to look at the whole person, and a lot of times they'll bounce back at that, but some people won't. And, that comes from the doctor's experience. But with the corporate places, they don't give a crap. They're just, whatever, they're just going to tell you, okay, there's some numbers, you have some pyroprocodine, and we're going to actually put some extra antibacterial and stuff in there. We're going to make the bill higher. And we're going to use this laser where the studies show actually it doesn't really do much. There are some really good lasers, but some of them studies aren't there, but more expensive. We're gonna push up our bill because we take these crappy dental insurance low fees, so we're gonna add all these stupid things that we know don't really work to put the fee to a place where we're not losing money. Ooh, this turned into an corporation video. It was supposed to be a gum disease is real video. That's all good information. All right, if you've been listening this long, holy 5 minutes is way too long.